Hey everyone, it's Dr. J, and today we're going to be talking about college mental health. Should I see a therapist on campus or off campus? But before we begin, if you're liking these videos, make sure you subscribe to my channel, and you can also follow me on Instagram at A Modern Therapist. The first thing you should know if you're at a university or a college is that you most likely have a counseling and psychological services center right there on campus. Now, this isn't the same place you go for tutoring or rearranging your class schedule or picking a major. This is a place specifically for mental health concerns like stress, anxiety, depression, relationship issues. Now we're going to talk a little bit about what differences you can expect if you go on campus to a counseling and psychological services center versus if you get seen off campus for therapy. So now that we know that there's a place on campus most likely for you to get help with mental health therapy, it's important also to know that these places are usually low cost or free. The reason why universities and colleges can afford to do this is most students pay a health fee. You don't realize you're paying for this because it's within your student fees. And student fees help pay for things like the bus service, maybe the rec center, maybe the health center that you have, but it includes a lot of different services. So a lot of universities can afford to charge students really low prices for mental health or counseling on campus because they're already paying for it in their student fees. The other good news of seeing a therapist on campus, aside from the price, is universities and colleges tend to hire a wider range of mental health professionals, from psychologists to psychiatrists to mental health therapists, counselors, social workers. I don't know if I forgot anybody in there, but the good news is universities and colleges tend to hire them all. And so this is really great because you'll have a wide array of mental health professionals ready to help you with whatever issues you present with. Now let's talk about the type of therapy you can expect on campus. University college counseling centers tend to see a lot of students and unfortunately tend to be understaffed due to budgeting and government funding not being where it should be. Want for sure. Because of this, university college counseling centers tend to operate on a brief model or what's considered a short-term model, meaning that they'll have session limits for individual therapy. So most will see someone anywhere from 8 to 12 sessions. There can be variability in this. Some universities are shorter, some may be longer, but rarely, if ever, will they see a student throughout the entire time they're at the university because they just don't have the person power. Most universities will conduct what's called an initial assessment when you first come to the counseling center to determine whether they can ethically treat you within that short-term model. Now, there's a lot of different issues college students face that would be ethically treated within a short-term model, including social anxiety, generalized anxiety, mild to moderate depression, test anxiety, adjustment issues, just to name a few. But if somebody is having severe symptoms or someone's requesting to be seen at least once a week or more, it's likely they're not going to fit into a short-term model. That level of frequency is usually best done in the community, which leads us to off-campus therapy. The biggest perk of being seen off campus is going to center around the theme of choice. Choice is going to come into play in a lot of different areas, from choosing a therapist with a specialty that you might want. Maybe they treat OCD or an eating disorder or another presenting symptom that you really want to focus in on. Or maybe you want to pick a therapist that does a certain theoretical orientation like CBT or humanistic or psychodynamic therapy. This can also come into play with choice of how often do you want to be seen. Some people just want open exploratory therapy where they know they can meet with their therapist once a week and develop a bond and connection to explore their emotions and better know themselves. The way choice gets taken out of this equation is if you decide to use your insurance. There'll still be some choice options when you look through the insurance providers in your area, but many insurance companies will dictate how often you get seen. So when looking off campus, if you privately pay for therapy and you pay out of pocket, it's going to give you the most amount of choice, but it's going to cost you the most amount of money. You can still try to find a therapist that has a sliding scale, which essentially means that they're open to negotiating a price that will work well for you. If you use insurance, you're going to lose some of that choice, but likely save some money. Okay, so let's summarize here, knowing again that these are just generalities. If you want the specifics of your university college counseling center, make sure you go hunt down that website, find the office on campus, and ask as many questions as you have. So, again, on campus therapy tends to be very affordable. It's also convenient, right? Once you find it, it's right there on campus. It's also likely to have a wide array of mental health professionals with specialties that are used to treating college students. On campus therapy is usually short term in nature and it may have an individual session limit. Also, the frequency that you're going to be seeing at a university college counseling center is most likely not going to be weekly, and I can almost guarantee it won't be multiple times a week unless you're doing some combination of individual therapy and group therapy. Off-campus therapy, it's going to give you a lot more choice, especially if you private pay. You're going to be able to pick a therapist with a specialty that you want and likely come to a frequency of therapy that meets your needs. If you use insurance, you might lose a little bit of that choice, but you're going to save money. Overall, you don't have much to lose except for time if you go to your university college counseling center first for that initial assessment. Because again, if you're outside that scope of treatment, they're going to refer you out anyways. Generally, I only recommend going off campus right away if you know you want to be seen at least once a week or more for treatment, or if you just know you want a long-term therapist, somebody you're going to see for many months, even years, where there's no end to that therapeutic relationship. Hey, thanks for watching. I hope this video helped you understand some of the differences between being seen on campus for mental health therapy versus being seen off campus. But no matter where you get seen, the most important step is the first one that you make, picking up that phone to schedule that first appointment. And I hope you do it. Stay tuned right here at A Modern Therapist for plenty more videos to come.